Back in the day, there was this idea that treatment for THD patients meant cure. We require lifelong care, period.
Pediatric cardiology has had enormous success. The vast majority of children born with congenital heart disease survive to adulthood.
You successfully made it through heart surgery, and then we thought, that's it, we fixed the problem, off you go, never to worry about this condition again.
I have recently learned how many people have the same experience I have. You just stop going to the doctor. And the reason I stopped was more because I thought I was fine.
Adults with congenital heart disease, 1 in 2, will experience a mood or anxiety disorder in their lifetime. 50%, which is a strikingly high rate.
I just felt like I was alone. If I had someone come up to me and say, oh, we have a therapist, we have a psychologist who can come and talk to you, they're part of our team, that would have just been massive. That would have changed my life.
Congenital heart disease is not only a physical battle, but it's a mental battle as well.
Two, 3 decades ago, you either were born with such a complex heart condition that adulthood really wasn't in the cards. Really, success was getting out of the hospital, or success was surviving surgery. Thank goodness, those children with complex congenital heart disease, the vast majority are surviving into adulthood. Or you had a heart condition that was relatively mild, you successfully made it through heart surgery, and then we thought, we fixed the problem, off you go, never to worry about this condition again.
Congenital heart disease is a lifespan condition. A fetus, a 1-year-old, an 80-year-old, they have had that diagnosis since birth.
One of the great challenges is that we're building a field while the need is ever present. There are now 30, 40, 50, 60-year-olds with complex congenital heart disease, and that didn't exist 10, 20, 30 years ago.
There should be an organized approach to transitioning care from pediatric care to an adult provider. Our healthcare system makes that challenging at times. Many centers have transition programs, sometimes more on paper than in reality. Transition programs, everybody agree, are important. Everybody values them, except for insurance companies and any other payer. Centers often don't have a very robust or comprehensive true transition program with the type of education and resources that we wish were the case. Patients and families probably could have the most impact in is demanding true transition of care over adolescence into adulthood.
It is very unfortunate that at the time that we are most in need of that successful transition, the individual is most vulnerable to losing that transition. I think the big thing we've come to realize is that we don't talk about transition starting at age 18. We talk about transition early. It's also up to us in the pediatric cardiology world of not just introducing the transition, but explaining the why. Why is it important? Your heart can affect your kidneys and your lungs and your liver and all other organ systems in your body. And in the adult congenital heart community, there are particular risk factors for not just the heart, but for all those other organs. You have to go see a team. You need to be at a center that can best care for all of that. This is where the field is growing and evolving. There are these two groups, one that we told you'd never have to worry about it, so now we have to find them and bring them back. And then this other group where they never suspected that they would have the opportunity to get married or have children and what their contributions would be from work. We need to make sure that we're providing them all those opportunities, and that is a challenge.
Here is Kira. Our life is nothing but an adventure. We have such an amazing life together, filled with such wonderful people. Let's fill this book with stories of us and create so many we need a dozen more.
Man, my thoughts are I'm so happy it's finally here. Kira, since I met you, I knew that I wanted to be with you. Thank you for agreeing to be with me. I love you so much. I will always be there for you. I know you'll always be there for me. I love you. My mom was gestational diabetic, and so the last several weeks of pregnancy would go in, and she had a contraction. They told her that she was going to have a baby that day. Did not know about my heart problem. My heartbeat was very low. She had an emergency C-section. I came out, I was blue, I was hairy. I can call my mom right now. I could say, Mom, tell me two things that describe me when I was born. And she would say, Chewbacca Smurf. She didn't even really get to hold me. They immediately took me away. But I had a shunt at 10 days old. And then again at 16 months, I had another open heart surgery to patch a hole in my heart. When I was born, if my mom hadn't had gestational diabetes, the cardiologist at the time is pretty certain that if I had gone through a regular birth, that I wouldn't have made it. I've been growing up my whole life being told I was here for a reason. My heart problem has really been a trait, something that I have recognized as an opportunity to do something with my life. I'm a father now, and I think that's the first real moment where I really knew I really had a purpose. I mean, I'm a husband too. I think making my wife's life better probably was part of it too. That's a joke. Very active lifestyle growing up. I did have limitations with my heart problem, but I had to be mindful of how quick my heart rate would accelerate. But I ran track in high school. I was a big kayaker all throughout high school. I played soccer, I played tennis growing up. I really did all of these things, and I felt very normal in that regard. I was very healthy. We had heard that I needed a major repair by about 18 years old. 18 came and went, 19, 20, 21, 22, 23, 24. I kept going year after year after year, and they kept telling me, you're a miracle, you're in extremely good health. Then I graduated from college and I moved up to Washington, D.C. And I was so focused on the daily grind that I just did not get a cardiologist. I have recently learned how many people have the same experience I have. You just stop going to the doctor. And the reason I stopped was more because I thought I was fine.
Hey guys, I just want to say thank you and I love you, and I am super thrilled that you all are my friends and family, my support team. I love you bunches. Keep you informed. Bye.
I just remember thinking, oh my God, open heart surgery, 29 years old. I guess I knew I had a heart problem, but this is real.
I am a survivor. I am a survivor. I'm a survivor. Ugh. Ooh. Thanks, guys.
But I had gone 5 years without seeing a cardiologist. So if I hadn't had that moment where someone else favorably interfered with my life before it got to that point of no repair, I wish I could have figured it out earlier.
And to start, I would love to ask our panelists just to introduce themselves and their experience or how to relate to CHD.
I'm Justin Johnson. I was born with tetralogy of Fallot. I'm 35 years old. I really only heard about my heart problems until 28 years old. This is my daughter, Shay, our daughter, Shay. And, you know, being an adult with congenital heart disease, life doesn't slow down. So it's wonderful to be part of something like this, because to be able to share a life like normal people is really a blessing and special. So.
Hi, I'm Kira Johnson. I'm Justin's wife, Shay's mom. Apologies in advance for her.
We should have got a babysitter. I also want to say something. I've had 3 open heart surgeries. My first was at 10 days. My second was at 16 months. And so my entire life, I would go in and I would hear that I was a miracle, or that I was cured, or that I was healthy. And I stopped going to the doctor at 24. And like, I haven't got emotional the entire day talking about it, but somebody in my life had a chance who worked in the profession connected the dots at Children's Sat National for me. Asked me to do it, 4 months went by, and then connected me. And I went in, and before I had a problem, like, I found Dr. John and that team, and I was able to get care before I had a major problem. And it was within a year that it would have been a major problem. And I met Kira right at that time. And sorry, she just, I did not expect this. She just stepped up. She took 2 months off of work when I had my surgery. And she cared for me. I got it. That was a hard time in life. Kira took care of me. We joke, like, when she met me, I actually saved my name in her phone as Justin has a big heart. It's funny, I met Kira and my heart started to grow too large that needed surgery. All the people in our life that cared a lot about us wanted to come at the same time and all be there right after the surgery. We said, why don't we stagger your visits? And so there was 3 weeks where we had uninterrupted friends and family staying with us. And that was just a really special time in my life. Though it was physically challenging, I got to focus on the best relationships. And it put everything in perspective. But I do feel like I caught it. That's a lucky story. Don't rely on luck. Do anything you can preventatively to be aware of what your status is with your current health.
Anytime I went to a physician's office, I was told, my parents were told, Noman will live a normal life. Noman will live a normal life. Me being ill every year due to pneumonia possibly is my normal. Our normal is very different than the person who doesn't have CHD. It went to the extent that I only had a few months to live. Pakistan did not have the technical know-how to deal with such cases. Resources were tight for us. Getting me the right treatment was almost impossible. You know, my parents didn't give up, and specifically my father. During his job, where he worked in a bank at the time, he met an American client who commented on my picture on his desk. And naturally, my dad, got a little upset. He started crying, knowing what was to come of me. And he told him, I want to help you. Meet me tonight for dinner. So it turns out this gentleman was the vice president for Asian Affairs for Lions Club, who work on medical missions. And he told my father of this program on a lottery basis. And he said, it's a luck of a draw, but do apply for it. So my father applied, and somehow I got selected to come to the USA for treatment at Deborah Heart Lung Center in Brownsville, New Jersey, and I had a full repair. And after that age, I started going under the radar, unfortunately. It was about 2016. I was studying for my cardiovascular exam, ironically, and I'm sitting across my friend in the library, and she tells me, why is your chest thumping? But then I started getting shortness of breath, and then I told her that, hey, take me to the ER. This is not normal. Took me to the ER, and the ER doctors, they sort of freaked out a little bit, naturally, because they haven't seen the EKG that they saw. So I came to see a cardiologist, and even they haven't seen this before. And that's when I called Deborah Heart Lung Center, because that's where I got treated before. So they said, you need to get a pulmonary valve replacement done. It was decided that they were going to shift my case to Cincinnati Children's. So the only option left for me was open heart repair, which came as a blessing in disguise. The reason being is because Dr. David Morales, he went in, obviously took care of my pulmonary valve, but he also found a hole in my tricuspid septal leaflet. My heart was damaged to the point that the tricuspid valve was damaged as well. And it took about 12 hours to complete that procedure. The surgery was the easy part. After my surgery, I'm not gonna lie, I had nights where I cried. I literally cried for hours. And I used to wonder why. Why am I crying? And the reason is because when you go into open heart surgery, they move things around in the body. For example, the vagus nerve. That's part of the parasympathetic nervous system. That's what controls your fight-flight response in conjunction with your sympathetic nervous system. When you start touching that physically, you're gonna have those manifestations after surgery. Health does not just mean physical health, it means mental health as well.
Came home from work, turned on the TV, fell asleep, and when I woke up, thought my arm fell asleep. Thought nothing of it. Then I tried to roll over off the couch. When my leg didn't move and I smacked my head against the coffee table, that's when all I know is that something was wrong. I lost all my feeling in my whole left side of my body. When I woke up and was conscious in the hospital, they told me what happened. I couldn't wrap my head around it. Realizing that I actually had a stroke at 22 years old.
Hi, Zach. How are you? Thank you. Did you have a good trip with your brother? Come on in.
My stroke is related to my congenital heart disease. It was a long process getting back to normal. Doing physical therapy in the hospital, and I kept a pretty good attitude with it until one day where I just broke down because I wasn't going as fast as I could. The physical therapist she didn't let me, which I'm very grateful for. But then that night I kind of went into my room, and that's when I realized that it wasn't just my heart condition that was going on here. It was probably a little more mental than I thought. I never thought about giving up, not even for a second. I had my spouts of depression. I wouldn't say that I'm depressed, but in the same regard, I definitely could have had help.
I really want to talk to you about something that's really important to me and your dad. We feel the best way for you to become a happier person is that you see someone for your mental health. And I'm going to tell you why. We found out 10 hours after you were born that you had a heart condition. A situation like this can bring families together, or it can separate families, and we were so fortunate in the fact that we all came together as a team. When you became a teenager and you had issues with your anger, we wanted you to go talk to someone. It wasn't something that you wanted to do. It concerned us. Now, looking back, we feel that had you been a part of a mental health program from day one, that it would not have the stigma that you have now about going to see someone.
Well, now that I've found another way to deal with my anger problem, I don't see it.
What is that? What is the other way?
I found the gym and doing boxing workouts, and it's helped me a lot. I probably do keep a lot of things in. Keeping them in is a lot better than just bursting out on people that you care about.
Zachary, there are times I just don't even come close to understanding what you've been through. I wake up every morning and I pray for you, and I pray that there is a time when you have confidence in you.
I like to stay positive, but it's really hard to some days, and I didn't know how to cope with it. When I go to the gym and hit the bag, that was my therapy, and it worked really well, but I still need help. It's a tough mental battle.
Adults with congenital heart disease, 1 in 2 will experience a mood or anxiety disorder in their lifetime. 50%, which is a strikingly high rate. And unfortunately, we know that very few of adults with congenital heart disease receive mental health treatment for these problems. There's a lot of work to be done. About 1 in 4 to 1 in 3 kids born with a congenital heart disease will experience a mental health problem. Most commonly, we see anxiety or attentional problems. We also know that developmental and learning challenges are more common in our congenital heart disease populations. Young people born with a complex or critical heart disease, such as single ventricle anatomy, about 1 in 2 will have a learning or a developmental challenge, which can, of course, exacerbate things like anxiety and attentional problems. The symptoms of heart disease or advancing heart failure overlap a great deal with the symptoms of depression and anxiety. So things like fatigue, problem sleeping, lack of appetite, limited energy, not wanting to spend time with our family and friends, chest pain, shortness of breath. These are things that we understandably see in young people with heart disease. These are also symptoms that we see in young people with depression and anxiety. Where heart disease starts and depression starts, we don't know. But giving tools for dealing with the depression and anxiety help us to understand the heart disease better and help the medical teams to better treat those symptoms of heart disease. As we have more young adults living with congenital heart disease, and we have adult congenital centers now, many of these transition programs are really focused on education and making sure that our patients know their meds, know their heart disease. So what's often missing is the mental health care piece. And I will say, in my experience, many of my young adults, they know their heart disease, they know all of their meds, but if they're depressed, they don't take them. And so if we are not including mental health care during this period of highest risk, then we are not going to help successfully transition our patients. And so that has to be a critical piece of transition programs as we're thinking about adult congenital heart disease care.
Tonight, meet a tri-state woman who was born with half a heart. Doctors said she wouldn't live long, but she has packed more living into 22 years than most of us do in 60 or 70. And it all started with a life or death decision her parents made.
I was born with a congenital heart defect called hypoplastic left heart syndrome, which basically means that I was born with virtually half a heart. I went through with the first surgery at 11 days old, came through that. Second surgery, 6 months, came through that. third surgery, 13 months, and then I went into heart failure again. And then I had a surprise fourth surgery.
After that, it was full steam ahead.
I started gymnastics, and my mom was on the phone constantly with my surgeon saying, "Is this good? She's ramming herself into the vault. She's falling really hard on the bars. Is this okay?" And the surgeon said, "Yep, that's fine. This is why we do this."
And so Megan has thrown herself into every adventure she can, always pushing herself to the next level. That's why she has the symbol of adrenaline tattooed on her neck.
I always just wanted to live, to feel the adrenaline pumping through my veins, and prove those doctors wrong that said I would never have a good quality of life.
And now at 22, the only limit on Megan is uncertainty. This week, she is undergoing tests to see if she needs further surgery.
It's really scary, especially getting older, because, you know, you don't know. And the oldest people with it are not much more than 10 years older than me. And so sometimes I think to myself, I only have 10 more years.
Extra minutes.
How much do you worry about that heart beating inside your chest?
I worry about it often, actually. You know, I go through time periods where it's very worrying to me. Are you gonna be able to have a family? Are you gonna be able to have kids? What is the outcome? Are you gonna have to have a transplant? And so it's kind of just a roller coaster sometimes that I have to ride.
Do you know the answers to those questions yet?
I don't know the answers to that, and I feel like a lot of doctors don't even know the answers to that.
How long do you think you'll be here for?
It's hard to say. It's hard to say. I just have to keep pushing forward and do what makes me happy and just live life.
How often do you think about dying?
Very often. It's definitely caused me some anxiety, I guess you could say, thinking that I could honestly only be here for like 2 more weeks. I could die in 2 weeks. What do I want to do in these 2 weeks that makes my life worthwhile? That if I'm laying on a bed and on my deathbed, what do I want to be able to tell myself that I'm happy with my life? I want to be able to say, I'm so happy that I went out and did that. I'm so happy with all the adventures I did. A CHD is part of the person, it's not their identity. It's very easy to get trapped into it being your identity. And lastly, quality of life is not determined by physical ability, it's determined by how you choose to live your life. And I think that's something very, very important that I hope all of you can take away from this presentation. Thank you. I remember going into CT and looking up and having the lights kind of swirl around me and thinking, I don't know if I can come back from this. It was horrible. You get told a stroke is possible because your heart obviously isn't normal. I remember them coming back in and saying, yep, well, you had a stroke. You actually had 2 of them on both sides of your head. It was crushing. I knew it could take over a year to start getting everything back, but a year is a long time when you lose yourself, what you feel like. I remember looking at myself in the mirror, and I didn't feel like I was the same person that I was, and I wanted myself to come back so badly, so badly. I just wanted myself to where I felt like I could accomplish things again and push more boundaries. I wanted that so badly, and it wasn't coming back. I really just seriously was contemplating what my next step was going to be. In walks this person. I remember looking at him, checking him out. It's like, it's pretty cute. He was just so understanding of everything and really pulled my confidence back up a lot. I fell in love with him very, very quick. I have a completely different outlook, way more positive outlook on my life right now. And I really want to take care of myself because, honestly, I found someone who I want to be around for.
I had had a stroke in 2015. As soon as I got to the hospital, they took me immediately to CT. As soon as I saw the lights swirling around me, I just started crying. And I had like a panic attack in the CT machine. They had to pull me out, pulled my dad in, and I said, no one's gonna love me. No one's ever gonna love me. The negative self-talk that I was just continuously telling myself was not healthy. I just didn't want to be a burden.
I never see her as a burden. It's more of a blessing. Her life has forced her to think in a way that I think is so special. Because of her condition, it makes her the person that I fell in love with.
With Dustin, it was the most comfortable I'd ever felt around anyone. I don't feel that people understand what it's really like to have to be standing by someone in sickness and in health. There's a lot that goes into a stroke recovery. It really messed up my psyche, especially through the recovery, because I was trying to figure out how to communicate in my new way, because it was taking me a little bit longer. And we just worked on the best way to communicate, and I had a partner with this in helping me learn how to communicate again and be patient with me. And that completely changed everything for me.
But that's not to say I was like perfect at it from the start, because sometimes she'll get really frustrated with herself because she can't figure out what she's trying to say, and it builds into this kind of full-blown panic attack that she's not able to process things the way that she used to be able to. To me, the mental health aspect was something that was a learning curve.
I think at first Dustin was thinking I was just so angry at him, but it was me internalizing just how angry I was that I had this stroke, and how angry I was that the way that I had handled things in the past, my coping skills and coping mechanisms that I had used throughout my life, weren't able to be used anymore. And so I felt like I was starting from square one again. And I feel like I missed out on a lot of opportunity of learning healthy coping mechanisms. If I had had the opportunity and I had had someone come up to me and say, you know, oh, we have a therapist, we have a psychologist who can come and talk to you, they're part of our team. That would have just been massive. That would have changed my life. I think with us being able to communicate and learning how each other communicates, it makes for such a more healthy situation. It brings us closer together.
We just understand each other on a much deeper level because of that.
I don't know, I couldn't tell you why I had an anger issue. I just know that when I couldn't understand something, I'd become angry, and the only way I could release my anger would be physical, and I know that's not the right thing to do, but I can't pinpoint why I was like that. I just feel like people are wired differently, and I was wired like that, and after my stroke, I think I came to a realization that I can't be like that anymore, because maybe me being angry all those years, high blood pressure and, you know, short temper, is maybe that was part of the reason I had a stroke. So I took care of myself for 30 some years with dealing with this. I just felt like I didn't need help getting through it.
Well, the most important thing is for you to know what you're going through. It's important for you to talk through those issues with someone so that you understand where you're coming from, so that whatever's down deep inside of you comes forth so that you understand it. And talking with someone sometimes can help you realize that. Let me ask you this question. Now that mental health is a part of your adult clinic, is it something that you might want to research and check out and see if there's something that could be a part of your clinical visits?
Something to consider. I would like to go and see what it offers. And I definitely, I mean, talking to someone I know would help. It's just talk about all aspects of life instead of just me being a heart patient or a stroke victim, and help me get through just, life. It'd be a lot better than just harping on what, I already knew.
And what you can't control.
Yeah. Yeah, that'd be very helpful.
I often talk with my patients about what they can control versus what they can't control. Unfortunately, there are many parts of heart disease that they can't control. But following up with care, taking their medicines, going to their appointments, those are within their control. And so not only is that good for their cardiac health, but that's good for their mental health. Speaking up and sharing your stories, that is the best way to destigmatize mental health care problems, but also get the help and the advocacy that we need to best support our patients and families.
If we know that they're at high risk for heart failure, if we know that they're at high risk for dangerous arrhythmias, if we know they're at high risk for death early, 10, 20, 30 years earlier than the general population, well, we have to go find them.
The field of congenital heart disease has rapidly evolved with lots of different changes in surgical techniques, treatment options, medical therapeutics. But the thing that we really struggle with is really being able to follow patients long term and really understand what their needs are, especially as they grow to adulthood.
The people behind the Congenital Heart Initiative, we all put our voices together to create a digital platform for patients to provide their data and connect the community in a meaningful way.
We don't want just research, we want better research. We're inviting adult congenital heart patients to answer sets of questions that have been developed by researchers, clinicians, and other adults with congenital heart disease.
I think that this is a patient community who's been through a lot, regular clinic visits, multiple surgeries, and what that ultimately means for a lifetime living with a congenital heart disease will really help us understand where are those needs that still remain in our community that really bring hope and a brighter future for all ACHD patients.
And the hope is that this is then a long-term project. And so we're at the start of that. So the hope is in 10, 15, 20 years that this will really be a well-oiled machine that will be helpful for the community and really will result in better patient outcomes.
So much unpredictability in tomorrow, but you have today. And so I want to teach our children how to make the best of what they do have. And I think when you're given a problem or adversity, you can feel really sorry for yourself, or you can feel empowered to take responsibility and do something for it. And so if I can use the cool scar to help her understand, and truthfully, I'm probably gonna have a surgery that she's going to remember. And so if I can use that moment to teach her to be thankful for today, I think that's another lucky moment in my life.
Am I going to be around long enough to take care of my family? And it's not just am I going to die, it's I'm going to have another surgery at some point. And that recovery is probably another 2 months. And to have 2 rugrats running around during that and putting all that pressure on my wife, who also works full time, she's my better 2/3. Like, she's super impressive. That just motivates me. And I think being alive in this day and age and the advancements that we're seeing that there's so many opportunities ahead. If someone tells me I need to have an operation to prolong my life, I'm pro doing that. And so I'm really thankful to be alive in this era, to even have this opportunity. I want to make the best of it. But at the end of the day, the responsibility falls on you. The responsibility falls on me to be in control of my health. And if I take responsibility for it, I can do things that improve my longevity.
The biggest thing for me after my surgery was that there was a big thought that whether I should quit medical school. People came up to me and told me that, are you sure you can do this now? And right hand to God, I thought about it. I thought about quitting. It'll be due to my own illness. This is my disability and I have to accept it. But no, I'm not giving up. I'm doing well academically. Yes, I've had bumps in the road, without a doubt. I've had numerous medical leaves. But that's not to say that, you should give up on your dreams. This is my dream. In the amount of time we've had this conversation so far, 15 minutes, another child with a CHD is born. So if I'm doing this, I'm doing it for that child. So that he can wake up tomorrow and that parent can wake up and know that there's a child who went through medical school training, did fine, regardless he had bumps along the way, but he made it though. So it's for them.